Hello, everybody. Steve Grove here, Commissioner of Deed. Thanks for joining us. We're eager to engage with all of you today and answer further questions you might have about yesterday's executive order. Obviously, a lot of impact for business across the state, particularly in the hospitality industry. I'll offer a couple of comments up top, and then I'm going to turn over to my colleague, Assistant Commissioner Dan Huff from the Department of Health, to walk through some of the context for this executive order, and then to the Commissioner of the Department of Labor and Industry, Rosalind Robertson, to walk through some of the details on the guidelines, and then we'll get to your questions as well. I will say just quickly, we had some technical difficulties with the question and answer function within this platform. So our teammate C Yang just sent out a form to all of you over email. I think it's just a Microsoft form. If you could use that form for questions, we'll pull your questions from there. Given the number of folks on the call, doing questions live isn't practical or doable, but we can pull them from that form. And if you submit a question, we'll answer it, whether it's here or afterwards. We're going to make sure everyone has clear guidance of where things stand and what lies ahead. So again, I'll be brief, but just to say we recognize this is a really, really difficult time for the state of the pandemic, and certainly for business. And as you know, a week ago, we were having a similar webinar where we were talking about a very different set of restrictions that were laid out, much more targeted, early closure times for bars and restaurants, restrictions on weddings and celebrations and on social gatherings. Our hope, of course, was that that could be enough to start to turn the tide. But even in the week since then, things have rapidly shifted. And Assistant Commissioner Huff will get into this in a moment, but the health situation grew very precarious very quickly, far faster and far more deeply than even the local and national experts predicted for our region. And at the core of that was really hospital capacity and our ability to take care of those who are sick. Cases, of course, skyrocketing, and we're very concerned that Minnesota and the Midwest in general is now the global hotspot for COVID. So drastic action was needed. I recognize that action has been very quick. We know that only 48 hours of lead time is not ideal for businesses. I myself have spoken to hundreds of businesses over the past 48 hours, and I'm very aware of the challenges that restaurants and bars face with inventory, that any business that has to pause for these 4 weeks faces as it relates to planning. Our sincere hope, of course, is at the end of this order on December 18th, we will be able to reopen. It's a doable thing if Minnesotans can drastically shift their behavior and get this virus under control. But of course, that lies in the hands of all of us to come together and navigate this as one Minnesota and as a state that needs to really turn the tide here to make room for more economic growth and for the health and safety of our citizens. So I'll leave it there. We want to get as many questions as you can. Again, thanks for joining us. Thanks for your perseverance and your leadership throughout this pandemic. It has been tremendous. We want to share more with you about this next chapter of things, and to that, I will turn it over to Assistant Commissioner Dan Huff from the Department of Health. Dan.
Thank you, Commissioner, and I just want to echo Commissioner Grove's sincere thank you to all of you for being here today, and also just acknowledging how awful this is for every one of you and the economic impact it will have on you. I wanted to just go through, from a health perspective, why we had to make this drastic move. And it's really that our case growth has gone exponential in Minnesota, and exponential means that you just double every week, and that's what we're seeing happening. We don't know exactly where they're coming from. A third of our sources are from community spread. That means people are getting it out when they're socializing or out and about in the community. We are overwhelming our basic infrastructure, our public safety, our hospitals, our childcare, our schools, our basic infrastructure is being overwhelmed because of the volume of cases and the fact that everyone working in these sectors are people too, and they are also getting infected. Next slide, please. The governor showed this slide last night. It took us 29 weeks to get our first 100,000 cases. It took us 6 weeks to get our next 100,000 cases. We're going to make our third, we're going to get up to 300,000 cases in less than 3 weeks. That's what we talk about with exponential growth. We're doubling at a rate so that we're just increasing our cases exponentially. Next slide, please. Here is the curve. This is not the curve we want to see. You can see that we did a really good job in Minnesota for such a long time. And the thing about exponential growth is it's like a truck that has run away down a mountain. Once the brakes go out, it just gets faster and faster and more out of control, and that's where we are. So you see this hockey stick phenomenon in our chart. Next slide, please. And this is what's happening. In less than a month, we went from an overall day-to-day case growth of less than 11% to now over 75% case growth over per week. And that is just unprecedented. Next slide, please. And what this means is our healthcare is being stretched to the max. We have, if we look at our data from September and October, of all the cases, 5.1% of our cases are hospitalized. Now, September, October, it was a little younger cohort than it is now since it's so widespread, but let's go with that 5.1%. If 100 people are infected, that's 5 people are in the hospital. At 1,000 people are infected, that's 50 enter the hospital. And at 10,000 cases, that would be 500. Well, we're close to 8,000 cases a day. So you can imagine what that means per day, the number of people that are entering the hospital. And on October 1st, we had 120 people in ICU. And we had 395 people just in the hospital, 395 October 1st. Yesterday, we had 355 people just in the ICU, and we had 1,706 people in the hospital with COVID. It doesn't count all the other people that are in the hospital for slipping in the ice or breaking a bone or being in a car accident or having a stroke or what have you. And so you can see that our bed capacity is really in dire straits. There was an article in the Star Tribune today. We requested ambulances from the federal government, and they are delivering 25 ambulances with ambulance crews. The one purpose of those crews is to transfer people from hospitals that are full to find them at a bed where they can have a staffed bed. So if I go to the emergency room and that hospital is full, this ambulance will take me to another hospital, find a hospital, and take me there. We are having to do this more and more. In fact, in August, we only transferred 4 patients because of lack of bed space. Just from into November 1st to the 15th, we had to transfer 203 patients. That means 203 people showed up at the hospital and there was no bed for them, and they had to be transferred. And this is increasing exponentially. We are in a very scary place here. Next slide. But it's not just about bed capacity, it's about healthcare workers. If you don't have a doctor or nurse to staff your bed, a bed does not do you any good. And some hospitals are reporting that 10% of their staff are out, either because they're infected, a family member is, or they're in quarantine. It's also infecting our fire departments and our police departments, because they too are getting sick or have family members that are sick. And we are having departments that are having difficulty staffing shifts. So that is a huge impact, that our first responders cannot staff their full shifts. Next slide. And then also it's we really want to focus on how do we make sure that our children can be in school and that our children are getting the education they need to carry on and be, important members of our society. But the other thing is, if kids are home, then parents are home too. How many people do you know that are doing kindergarten right now with their kid? We need schools to be open and we need daycares to be open. We have, just like in all these other areas, childcare workers are getting sick, teachers are getting sick, and then students are getting sick. This has come on really suddenly. We have to take dramatic measures if we're going to keep our basic infrastructure of our society working. Think about the nuclear engineers who run Monticello and Prairie Island. Well, we need to keep them well. They need to stay well so they can do their job. All the linemen and women who are keeping our power grid up. You know, this is throughout our society and throughout our state, and dramatic action, unfortunately, is what we have to do to protect the basic fabric of who we are and how we function in Minnesota. Next slide. So what we need to do is everyone needs to stop all their social interactions with other people outside of their household. Stay within your household pod. And that means do not hang out with friends, do not go out with people, do not socialize with people. Stay at home as much as possible and lay low. Go to the store and come right back. Don't socialize at the store. Do your activity that you have to do to continue, living, but we have to really curtail any of our social interactions because of this exponential growth. We have to put a huge downpour on the spread that's happening in Minnesota. And unfortunately, these venues that we're talking to you about today, that is where people can go and socialize and interact, and it's where they are together for more than 15 minutes. If I'm in a store and I'm moving around and I buy and I go home, I'm not really interacting with someone in my space for more than a couple of minutes. It's when we are next to people in an enclosed space for more than 15 minutes. Any activity where I'm breathing, vocalizing, talking, singing, breathing hard because of exercise ups the risk. Any activity because I'm eating or drinking that I don't have a mask on ups that risk. The longer I'm with someone else outside of my household ups the risk, and anytime I'm indoors ups the risk. There is no interaction that is safe, but what we have tried to do is to target those areas that have the highest risk at this point. Next slide, please. Which this slide just reiterates what I just talked about. So getting a haircut, we just know that that's a lower risk from our outbreak data, and also it's just a few people involved and people are masked. Shopping, and then we know that getting together with friends, especially eating or drinking, regardless of where it is, a restaurant or in your home or your backyard, is not safe. Next slide. So now I'm going to turn it over to Commissioner Robertson with the Department of Labor and Industry. Thank you.
Good afternoon. Now's the time to dial it back. We've talked about this for a while. In the spring, Minnesotans were asked to stay at home to allow the state to build its capacity. We asked Minnesotans to stay at home, and Minnesotans responded appropriately. During that time, we were able to flatten that curve, if you recall the slide that was previously shown. We were able to do that and keep the virus pretty much under control, never meeting our desired target, but nevertheless keeping the curve flat enough that our systems were not overwhelmed. Well, unfortunately, it's time to do exactly that same thing again. Reduce those interactions to reduce the spread. The state of Minnesota have worked diligently hard to ensure that our front workers are getting the necessary PPE. We've heard that repeatedly. The state is in a fairly good position with securing and stockpiling PPE that hospitals can call upon in their time of need if their critical supplies fall below a certain level. as noted earlier, our hospitals were in a fairly good place, but now we're at the risk of those systems not being able to respond in an appropriate manner. We've increased our testing considerably. We continue to expand testing, and Minnesota just recently was recognized for our dashboard and our efforts in making testing available far and wide in the metro, in the outstate area. We just, unfortunately, it's that time that we need to contract our activity to minimize or reduce this exponential spread, slow this surge down so that we can get a handle on things. Next slide. So what's impacted? Social gathering beyond your own household. It's a tough ask, but it's very necessary. We have to pause today so that we can look for a brighter tomorrow. 4 weeks, we believe that if we take the appropriate actions, that surge will start to come down. So we are asking that social gathering just simply be limited to your own individual household and in your household. Services that are being impacted is indoor dining, not available in the next 4 weeks. However, we want to encourage folks that as we refrain from in-person dining, that we're looking for opportunities to continue to support our businesses, and we are encouraging individuals to order from our local restaurants to create some revenue streams to businesses that are struggling and have been struggling for quite some time. Adult and youth sports, we need to slow that. Fitness gyms, other activities that bring people together. The community spread is such that all activity put us at some risk. Certain activities put us at greater risk. Receptions, private parties, other celebrations, so wedding celebrations, the birthdays, the anniversaries. At this time, we're asking individuals to refrain from those activities. Next slide, please. The establishments that are impacted: bowling alley, bingo halls, theaters, again, receptions, different types, private parties, other celebrations, outdoor events, and entertainment. We're simply at the point where all interactions outside of your trusted, familiar bubble continues to put us individually and collectively at risk. Next slide. So, we certainly recognize that this is hard, it's difficult. We understand COVID fatigue, but we also understand that we simply are losing the capacity to provide those critical services to the individuals who need it and will need it. So we know that the business community and all of us, we've given up a whole lot. 2020 has been a difficult year on many fronts, but unfortunately, now is the time that we have to step up in order to create a better opportunity for next month at this time. The governor, all of Minnesota leadership is simply asking that we continue to refrain, stick close to home, stay with your own family group, and cut out anything that just absolutely does not have to be done at this time. We know it's difficult, but we are in this together. And if we continue to work together, I believe we will come out of it. And this, hopefully this time next month, we will see the benefit of slowing down right at this time. So thank you very much, and I'll turn it back to Commissioner Grove.
Thanks, Commissioner Robertson and Assistant Commissioner Huff. Very well said, and I know there's lots of questions, so we'll get right to them. I do want to note that we have with us today also one of the COVID-19 response leads, Lauren Olivan from the Department of Health, who will assist in answering a lot of these questions as well. We're grateful she's joined us too. So again, we've emailed you that form. Please use it to submit your questions. The question and answer function within this platform is having some technical issues, so check your email for that form. And I'm going to turn over to Jen Gates, our Communications Director at DEED, to moderate this portion of the webinar. Over to you, Jen.
Thanks, Commissioner. The first question will be for the Department of Health. The governor has repeatedly cited numbers and data as a source of any executive action, including this last shutdown. What metrics have been identified that will be used to determine whether the shutdown will be lifted on the 18th?
Excuse me, this is Dan Huff. You know, that's a great question, and it's one of the things that we're looking at. And ultimately, we want to make sure that we have suppressed the virus enough that we don't then go right back up again. And our epidemiologists are reviewing what's happened in other states, what's happened in other countries, so that we can make, you don't want to keep the brakes on too long and just completely stall everything out. We want to let them up as soon as possible, but we don't let them up too soon and then just go right back into another lockdown because the cases increase so quickly. So we're definitely working on that, and that will be something that you'll be seeing in a few weeks as we work through that. So thanks for that question.
Thanks. The next question is for Commissioner Grove. Will the restrictions be evaluated on an industry-specific basis, or is this a one-size-fits-all shutdown? Either it all opens or it all stays closed on the 18th.
That's a great question. Excuse me, and I think that it will be evaluated on an industry-by-industry basis. Different industries are different. Different industries carry with them different levels of risk. You know, I want to note that clearly these orders yesterday that are going to effect tomorrow night were pretty broad within the hospitality industry, and that's because the challenge is that great. And like I said, last week we tried to do a more targeted step with the idea of early closure time and limiting gathering sizes. Those are the kinds of steps that we want to be able to take, more limited ones versus broader ones. But given the crisis we're in, we had to take a broader set of steps. You know, I think that you can expect as reopenings happen, we will be as targeted as we can and use as much data as we can to inform decision making. But I want to just, you know, say what I think is obvious, but it just bears saying. There is a degree of this that is the message we're sending to all of Minnesota about what we want you to be doing, which is just staying within that family pod. That is the core principle of this, and so it is so vital that people do that. It expands to all of these settings in pretty expansive ways that we know is challenging to the economy, but that we hope clearly shifts behavior and expectation and compliance in ways that will really help turn this around. Targeted moves when it's this bad just don't have the same effect. So it is that challenge. I think it's a great question and one we'll continue to evaluate moving forward.
And Commissioner Grove, while you're up there, could you talk about UI, what the state is doing to offer unemployment insurance for laid off employees and what that will look like in the weeks ahead?
Yeah, it's such an important point. You know, Our unemployment insurance system in Minnesota has been really strong throughout this crisis, thankfully, but has been put under a tremendous amount of stress. We've now paid out $8.7 billion on unemployment insurance benefits since this all began. Over 770,000 Minnesotans have received at least 1 week of unemployment insurance payments. That's about 26% of the state. So 1 in 4 working Minnesotans have gotten at least 1 week of UI since this pandemic began. It's a stunning number. The system has held up to that. It will continue to hold up to it. We do encourage those who are affected by this order to go apply uimn.org. Our team is ready. Our system can handle that increased load should it come. And we'll continue to pay out those state benefits. Now, of course, the big difference now is we don't have that same federal safety net, right? That $600 top off that was there from the federal government earlier this year is gone. The extended benefits for independent contractors and that extra 13 weeks expires at the end of this year. So we're worried about the federal component of this that is slipping away unless Congress acts immediately. So we'd encourage all of you to speak to your federal representatives, both in the Senate and the House, and urge them to work more expeditiously in DC on this. We know Minnesota's leaders are working hard on this in Washington, but you know, you can't get by forever on half your paycheck for unemployment insurance. It's just not practical. And this is a long crisis. This has not turned out to be a short-term thing that once 2020 is wrapped up, we're done. We're here at the end of 2020 and we're in the worst place we've ever been with the pandemic in Minnesota. Now we're optimistic, of course, on the vaccine. We think that's going to fundamentally change this thing and put it in our rearview mirror, but even that will take some time to administer, of course. And so we do need more help from the federal government. But your UI system will be there. We are in debt to the federal government right now. We're about $750 million or so in debt to the federal government on this. Most states are. In fact, many states are more in debt than us. But that doesn't mean that the benefits shut off. They are there, and we'll continue to administer them.
Thanks, Commissioner. If we can go back to the Department of Health, we have a couple clarifying questions, specific clarifying questions. How does this affect escape rooms? Can they operate if they only allow household groups in private rooms? There is no food and beverage in these facilities.
Hi, it's Laura. No, I'm afraid escape rooms need to be closed.
Thanks, Laura. A similar question. As a hotel, can we host a college basketball team for a socially distanced meeting with no food or beverage?
No, that is no meetings like that are allowed in the 4-week period.
Thanks. And referring to outdoor skating rinks, are they allowed to be opened?
Yes, they are allowed to be open, although no warming houses can be opened.
Okay, and we're getting several questions about gyms, if you can provide a little bit of clarity here. Is there an opportunity for a gym or fitness center to personally train or complete one-on-one training?
Not inside the gym, no.
I'm sorry, Laura, you might not have been live for that. Could you repeat that?
Yeah, not inside the gym, no. The gym facilities are closed.
Okay, thank you. And we'll go back to Commissioner Grove, please. Commissioner Grove, are volunteers considered workers and able to continue volunteering under the new executive order?
Well, I suppose it depends on what sector they're in. The order does not differentiate between whether you're being paid or not if you're working for a particular organization. If you're in the sectors affected by the order, then you are held back, and if you are, if you're not, then you can continue. It doesn't matter if there's a wage attached to it necessarily.
Thanks, Commissioner. A clarification about retail. With Thanksgiving next week, are there no restrictions at grocery stores? No controls with the number of customers in the store at one time?
This is a great question because we've all seen those pictures in the past of the holiday rush for shopping, and certainly Black Friday and events like that can get quite intense and quite packed. Most retailers we've spoken to in Minnesota are, and many of them, of course, like Best Buy and Target, have national footprints, are being very prudent here, and they're not organizing those same types of midnight madness events that were good marketing in the past, but now are horrible public health decisions. So we know retailers are adapting. I want to be clear, though, that there are still restrictions on retail. Retailers have to ensure that customers can remain 6 feet apart while they're shopping. So while we don't have a capacity limit or a cap on retail, you as a retailer have to make sure that your shop is set up such that people can remain safe and distant while they're shopping. And that's really important. Obviously, masks need to be worn. We've heard more and more retailers making sure they're very careful on that front, ensuring customers who don't have masks do wear them. A really important component of this order. So, but again, I think, you know, whereas earlier in this year we shut down retail, as every state who took the pandemic seriously did, we know that retail is not that environment of super spreading like other events can be, and so that's why you see retail being treated differently here than other sectors. Is it fair? No, none of this is fair. It's incredibly unfair. This whole virus is incredibly unfair. But again, to be as targeted as we possibly can be while holding back these social engagements is a critical strategy here that's part of the order.
Thanks, Commissioner. While we still have you up there, can you talk about state business support and if there will be more grant funds from the state for businesses to apply for assistance?
Yeah, you know, last week when we held this webinar, we were talking about that extra $10 million that was our intent to put into the Small Business Relief Grant Program that has now been approved by our colleagues in the legislature, for which we're grateful. And so that money will go to additional small businesses in that lottery. We will start with those for whom registering with the Secretary of State was the only eligibility check against them in the process, because there were many who won the lottery and that was a problem. So we're gonna go to those businesses first, so long as they can successfully register and prove that they're square with the state. But then additionally, we'll go into that waiting list and pull from additional businesses who were selected in that waiting list of the lottery. That does not mean there's a new application window there, or there isn't a new chance for businesses who haven't applied to apply. There's so many businesses already waiting in line from that program. And given the need to expedite the disbursement of those funds by the end of this calendar year, that was the fastest and most reasonable vehicle we could use. I wish I was here today to tell you that we had an additional several $1 million, and I can tell you we spent most of last weekend looking for ways we could pull money in. But one of the challenges, and that's just so frustrating and vexing, is that as economic need goes up, it's the same time at which the need to protect our economy through healthcare interventions is critical. And so that money from the CARES Act, which is dwindling at this point, as we all know, needs to be spent on testing and on healthcare response and on the surge, all of which are needs that are rising rapidly as case growth spirals out of control. So we weren't able to put more money from the state into this. And I'll be candid with you, the amount of money that state governments can put into economic revitalization at times like this is never anywhere near enough. This is truly why the federal government exists, is to support its citizens in times of great economic need. And it's why that stimulus is important. It's why Republicans and Democrats agree action is needed. This isn't just about blaming Washington. This is just how economies work. And if we don't get help from Washington, our state economy and others are going to continue to suffer. So it's a fair question, and I want people to know that we are looking under every couch cushion in the state government to see what we can come up with. But the needs are great, and we can't print our own currency, and we can't go into debt, and those are the challenges that that we face.
Thanks, Commissioner. The next set of questions are for the Department of Health. We're getting a lot of questions about virtual and remote meetings, about what's allowed. Laura, can you talk about if all meetings are, regardless of size, are prohibited?
Yeah, this is an area where we're getting a lot of questions, and I want to say that we're going to print some FAQs related to meetings and videos. So a small internal meeting that happens in your workplace as part of the functioning of your workplace that cannot be done virtually will be permitted to continue. But the first kind of point is that if you can work from home, you are working from home. So that's one. B, if you happen to be in a workplace, we'd still like to see you do a virtual meeting. So the kind of meetings that might continue would be small informal meetings that continue in a workplace. All other larger meetings, board meetings, meetings off-site, we're asking you to pause for the next 4 weeks. In both the gym and the places of public accommodation, we have small provisions that reference videoing from those locations. In the gym one, it is not so that anyone else would be allowed in the fitness center. It's if the worker, the professional that already works in that fitness setting wants to create a Zoom yoga class, that they can do so. Or in a place of public accommodation, if the workers that work in that setting are coming together in a socially distanced way, they can film that work. Those are really limited exceptions, and across the board, we're asking people to limit their interactions to a single household, go virtual where and when they can, and really limit all activity. And we do so because it is not safe to gather with other households or individuals at this time. We have a record high community spread rate, which makes it incredibly risky to connect with others. So these are not just rules, but these are kind of strategies to help people stay safe and protected and not end up in the very crowded hospitals. Thank you.
Thanks, Laura. A follow-up on that. Are NFL teams that come for a Vikings game, are they not allowed to meet? They are tested daily with strict controls.
So the only exception to our limitation on all sports play is for professional and collegiate athletes. And the reason is they operate under their own rules and have far more extensive testing regimes than are available to other athletes. So they can continue to operate.
Thanks. If we look at skiing places, the question is, can you keep your deck open for seating at an outdoor ski/snowboard area if it's attached to the bar or restaurant and event center? And should the chalet be closed for food and beverage service?
Great questions. So while we want to preserve and encourage the ability of Minnesotans to get out and enjoy recreation, there are limitations in the ski setting. So no on-site eating or drinking is allowed in any restaurant or bar in Minnesota, including those at a ski resort. And the chalet, because it's a place of public accommodation, must be closed. So the only area that we would expect to see open beside the hill would be for rental purposes, because it's a retail setting. And then even there, we expect to see social distancing. I should clarify one other thing. If there is a place that's a restaurant, it is closed for on-site dining, but individuals that are there could take that food out. So takeout is still allowed, but there's no on-site consumption allowed. So that would be, maybe they could take their hot chocolate and then head to the car.
Thanks, Laura. I'm hoping maybe you can provide some clarity around what is and is not allowed in terms of holiday festivals.
This is such a hard time of year to have this dialed back. I'm afraid that many of the planned festivals and community gatherings are not going to be allowed in the next 4-week period. So any kind of public setting, the more social gatherings are prohibited in the next 4 weeks. That's indoors and outdoors. So no entertainment, no gathering, no lighting, festivals, fairs, community celebrations. And we do that again to protect the health of Minnesotans.
Just a follow up to that, would it be acceptable for a group to organize a virtual event outside where the public would not be allowed to gather, no stage, food, limited staff would be required to film?
You know, it's hard for me to imagine what that exactly would look
And let me
like.
just add, I'm sorry, I missed a detail there where people could attend but remain in their vehicles.
Oh, so that actually is a good reminder. We do have a drive-through exception, but I'm not sure who the performer would be. So we also, the actual performer workers, there are separate rules for those. But so for example, at the Minnesota Zoo, we would still allow a drive-through experience. So that is a way that people can get out and enjoy maybe the holiday lights or what have you.
Thanks. And we're getting some questions in terms of what is the data that you would need to see at the end of this in order to reopen these businesses?
Yeah, it's such a great question, and one that we got in probably every sector call. I'm going to invite Assistant Commissioner Huff to join me to answer that question.
Great, thanks.
Hi, folks. Can you repeat the question, please?
Yeah, we're getting questions about what kind of data would you need to see at the end of this 4-week pause to reopen businesses and restaurants?
So, I think what we've done is we've looked at a lot of different states that have to see what they have done before they reopen. That's one of the things that we're evaluating. I don't have a set data point of what we're trying to achieve. I think it's important to note that if you look at our dial back measures that are on our public website, you can see just how far out of whack we are. If we look at cases per 100,000, we're now over 110 cases per 100,000. We don't want to be anywhere close to that. We want to be closer to 10 or 15 cases per 100,000. One of the things that we have to do, though, it's not just about getting the fire to die down, because we know it's just going to spring back up. We really have to get the fire low enough, the case spread low enough, so that it won't just flare right back up. I know I wish I could give you an exact data point right now, but that's something we are working on, and we'll be sharing in the weeks to come. Thanks.
Thanks so much. We have just a couple minutes here, and so Commissioner Grove, if we could get you back up, there is a clarifying question on UI. Are youth in high school and college able to receive any unemployment if they work 25 hours or more weekly?
Yeah, students who are in post-secondary school are eligible for UI, and their hourly and wage rate standards that determine that eligibility. Minnesota's law as it relates to high schoolers who work is that it prohibits high schoolers from earning unemployment insurance. That law was written in 1939, and we believe is drastically outdated. And we strongly have urged the legislature and have worked with advocates to get that law changed, because our perspective is, if you're a young person and you qualify for unemployment insurance based on the amount you've worked compared to somebody else in the economy, why shouldn't you receive those benefits? And for many young people today, they are supporting their families with their jobs. And so getting separated from that work by no fault of their own should entitle them to the same benefits that any other Minnesotan should be. There's no reason to discriminate based on age. But unfortunately, that is the statute that is on the books in the state. It's woefully outdated. It needs to be changed. So there is that kind of cutoff between high schoolers and college-age students that's challenging. But unemployment insurance, as I think everyone here who's spent time with it knows, is an incredibly complex federal program with a significant amount of eligibility requirements and rules associated with it. I'd encourage anybody who has questions to go to uimn.org. There are extensive FAQs and a whole host of topics here, and the team has laid out answers to all of them in great detail. So I would encourage folks to check that out.
Thanks, Commissioner. I do want to note that we are at time. As a follow-up to this webinar, we will be sharing a recording of this as well as the PowerPoint. And if you do have questions, I want to encourage you that we tried to get to as many as possible, but we weren't able to get to every single one. I want to encourage you to send those to criticalsectors@state.mn.us. We'll also email out that email for y'all. Thank you so much for joining.
Goodbye, everyone.
Thank you.